Now we'll perform the advanced abdominal techniques. These are helpful when you find abnormalities of the abdominal exam. Or the first two techniques will help you to better identify the edge of the liver if you're having difficulty. The very first technique is the scratch technique. What this is it's a form of percussion to identify the liver, but using a scratch instead of a tap. Sometimes if a patient has a rather large abdomen, it's very difficult to be able to hear the difference between the liver margin and the rest of the abdominal contents. Now, the technique is to place your stethoscope in the upper epigastric region and then to start low in the abdomen with just a light scratch. I'll remove my stethoscope so you can see that. A light scratch along the low abdomen, moving up until I hear a change in the sound as I am over the liver. So I'll have my stethoscope here, scratch low, move up. And as soon as I move over the liver edge, there will be a change in the sound. It'll sound much closer to you, much closer to the stethoscope because of the way the sound is transmitted to the stethoscope when you're sitting over the liver. Now another technique to identify the liver edge is the hooking technique, which is the normal or the typical way to examine the abdomen, or the liver, excuse me, is to come from the lower end up this way. But sometimes you can use both your hands and use this technique where you use your fingertips just pressing up under the rib cage to find the edge of the liver. And so what I'll do with this is press down deeply and firmly into the abdomen with my fingertips, and I can sometimes feel the edge of the liver there, which may be a little more distinct than the rest of the abdominal contents, feeling much more like there's something solid underneath your fingertips. Another one of the advanced techniques is spleen palpation with the patient lying on his right side. Nick, can you raise your gown here and roll over to your right side, keeping your arms up over your head? That's good. So this palpation technique allows you to feel the spleen as it's falling forward by gravity and more towards your hands. So what you can do is place one hand on the patient's flank, pressing forward, and the other hand, the right hand, pressing up under the rib cage, using kind of a motion technique like this, a circular motion, to find the spleen, which is a fairly solid organ sitting right up under the rib cage. You can find this and palpate this in younger or in thinner patients, not always in larger patients. All right, and you can roll over to your back again. And that was the advanced spleen palpation technique. Now the other techniques that I'll demonstrate are when you have a patient who has abdominal pain. And the first of these techniques is rebound tenderness. But we're going to say that Eric has pain in his right lower quadrant. And with pain in his right lower quadrant, I want to get a sense of whether or not whatever the problem is has spread beyond just the right lower quadrant. For example, if he had an appendix and this appendix burst, then there's going to be much more pain and inflammation beyond just the right lower quadrant. And so that's what rebound tenderness checks for. If I know that this patient has pain down here in the right lower quadrant, and let's say I can just barely touch this area but it's very tender, I can move to another area of the abdomen. I can press down and say, Eric, does this bother you at all when I press down?
No.
No, not at all. And then I'll let go very quickly, and I'll ask Eric, did that hurt at all when I let go?
No.
All right, so that's a sign that there isn't any spreading of inflammation around through the rest of the peritoneum. It's isolated to the right lower quadrant. A positive test would be that I'd press down, Eric has no pain, but then when I let go, he notices that there's some pain. That's the rebound or the bouncing back of the peritoneum. So that's rebound tenderness. As I discussed with the regular abdominal exam, if a patient has abdominal pain, there may be some guarding, and that you can see. And so rebound tenderness is a way to get away from that location where there's pain and where there may be guarding to find out what else is happening within the abdomen. The other techniques that you can use are helpful for either the right lower quadrant or the left lower quadrant. So depending on where your patient has pain, you would be checking these two signs, which are psoas and obturator signs. And what this is, I'll again demonstrate as though Eric has right lower quadrant pain. When there is an organ involved, such as the appendix or maybe another source of inflammation in the abdomen, if it's in the right lower quadrant, it sits right next to the psoas muscle, which you know is the entire muscle is the iliopsoas muscle, which allows the patient to lift the leg. So if I want to check for inflammation in the psoas muscle, I'd say, Eric, now can you stretch out your leg straight like this? Now hold it there like that. And what I'll do is I'll press down on the leg, hold it there. Now does that cause any pain in your abdomen when I'm doing that?
Nope.
No, not at all. Okay, you can rest your leg back again. So Eric was just using the psoas muscle. If there was inflammation on that muscle, as I'm pressing, or even sometimes just as he's lifting it, that would cause some pain in the right lower quadrant. Now if Eric had pain in the left lower quadrant, I would ask him to lift the left leg up, hold it up there, and I'm going to press here. Does that cause any discomfort or pain?
Nope.
Nope, nothing like that. Okay, so again, testing the left psoas sign in a patient who has left lower quadrant pain, or right psoas sign in someone who has right lower quadrant pain. The next test is also a muscle test too. In this case, it's stretching or moving the obturator musculature, and it's called the obturator sign. So the key to this is rotating the leg. Notice how I'm rotating the hip out and in, and what that does as I'm rotating is it's stretching that obturator muscle. The obturator muscle sits right in the right lower quadrant. So if Eric notices any discomfort or pain as I'm moving the leg around,
No.
all right, so that would tell me if there were pain that there's some irritation of the obturator muscle. So therefore, there is definitely something in that right lower quadrant causing his discomfort. So again, if the pain's on the left lower quadrant, then I would ask him to then rotate his leg back and forth here. Any discomfort as I'm doing that?
No.
Okay. And that would be left obturator sign for left lower quadrant pain. Now the last test is checking for costovertebral angle tenderness. This is more helpful if the patient has left upper or right upper quadrant pain, or diffusely ill-defined abdominal pain as well. And it's a check for whether or not there is any involvement of the kidneys in the abdominal pain. So I'll ask Eric to please sit up here. And if you can swing your legs over the side here. So if Eric has abdominal pain and I want to know whether or not the kidneys are involved with this, I'm going to tap over the costovertebral angle. The kidneys are located just about in this area here. So I'm going to start tapping just above that and ask Eric, any discomfort as I'm doing this?
No.
Okay, so I'm tapping, I've started above the kidney, I'm moving across the kidney and below, just as a little bit of warning for Eric about where I'm going to be tapping. And then I'm going to, so no pain with the right kidney. Now I'm going to check left side. Any pain here as I'm tapping across the back? Any discomfort there?
No.
All right, so no pain in the left CVA region, no pain over the left kidney. And that concludes the advanced abdominal testing.